Next, I'm going to do a mouth and throat assessment on my patient. So initially, I'm looking at my patient's lips, inspecting for color and moisture, making sure there is no cracking noted. I'm also looking at their oral mucosa. If you can go ahead and open your mouth for me. I am noting that, making sure I'm using my pen light. I am looking at the oral mucosa, noting that it is moist and pink in color. There's no open areas, sores, lesions noted. If you can go ahead and smile for me. I'm looking at my patient's teeth, noting that there's no decay. They are aligned appropriately for the patient's age. If you can go ahead and open your mouth again for me. I don't see any fillings noted. I am also going to look at my patient's hard and soft palate. I am making sure it's intact and moist. If you can go ahead and say ah for me.
Ah.
I'm noting that the patient's uvula rises upon vocalization, testing cranial nerve 9 and 10. I am looking at my patient's tongue for color, saliva, symmetry. If you can go ahead and stick your tongue out for me. And I don't know any white patches or open areas. The tongue is completely intact. I'm going to assess for strength, testing cranial nerve 12. So if you can go ahead and press your tongue against my hand, against your cheeks, each cheek, like, and on the other side. And again, the patient had already stuck their tongue out, so the patient has appropriate strength. I am looking at the patient's tonsils, inspecting for color, if there are any exudate lesions. Patient's tonsils are appropriate. They have not had any procedures like tonsillectomies or adnectomies. Lastly, I would assess cranial nerve 9 and 10 utilizing a tongue depressor to assess my patient's gag reflex. In the case of the head to toe assessment, you do not have to assess your patient's gag reflex. You can just walk us through the process. So I would have my patient stick their tongue out, and I would slowly insert the tongue depressor just to the left or the right of the midline of the tongue, directly back to the patient's back of their tongue until you are able to identify a patient's gag reflex. And that is the end of mouth and throat.